All right, wonderful students. This is the management of patients with gastric and duodenal disorders. Disruption of the mucosal barrier that normally protects the stomach tissue from digestive juices is gastritis. Acute is rapid onset of symptoms, usually caused by dietary indiscretion. It is typically self limiting. Other causes might include medications, alcohol, bile reflux. It could be radiation therapy. It could be a number of things, right? That's causing that gastritis. Ingestion of strong acid or alkaline may cause serious complications. And then a chronic condition is prolonged inflammation, could be atrophy of gastric tissue, could be due to benign or malignant ulcers of the stomach. It could be due to H. pylori infection, right? And it may also be associated with some autoimmune disorders and diseases, could be dietary factors, medication, alcohol, smoking, chronic reflux, could be pancreatic secretions or bile. I mean, there's like a number of things that can definitely cause gastritis. One type of gastritis is called erosive gastritis, and it wears away the stomach lining. The most common cause of erosive gastritis is a long-term use of medications called non-steroidal anti-inflammatory drugs, or NSAIDs. These will include aspirin and ibuprofen. When you stop taking these drugs, the condition usually goes away. But if the patient doesn't stop taking them, then erosive gastritis can proceed to peptic ulcer disease. Ulcers can cause gastrointestinal bleeding, and it can lead to anemia. Frequent ulcers can also cause scarring. Scar tissue in your stomach can become a problem if it narrows or even blocks the opening at the bottom, right? And you end up with a pylorus if that happens. Again, manifestations of gastritis acutely, you end up with epigastric pain, dyspepsia, anorexia, hiccups, nausea, and or vomiting. Erosive gastritis can lead to melena, hematemesis, hematochezia. Chronic gastritis can lead to fatigue, pyrosis, belching, having a sour taste in their mouth, could lead to halitosis, early satiety, anorexia, nausea, vomiting. It may lead to pernicious anemia due to the malabsorption of vitamin B12. Sometimes patients are asymptomatic. And a definitive diagnosis is done by endoscopy as well as histological examination of the biopsied specimen, right? So they'll go in with an endoscope, take a sample and send it off to be biopsied, right? And tested. Okay, medical management of gastritis. So treatment for gastritis includes total cessation or stopping drinking alcohol, stop smoking, stop taking anti-inflammatory drugs, not eating any spicy food, as well as managing stress. It may involve immunomodulatory therapy, like autoimmune enteropathy. It could be dietary modification. Additionally, the patient should get supportive therapy like IV fluids. It may include placing an NG tube for decompression or to allow the bowels to rest. It could be antacids or maybe H2 receptor antagonists, or maybe we're giving a proton pump inhibitor or PPI medication. So, what exactly is the first line treatment for chronic gastritis? Typically, it's twice daily, a PPI or proton pump inhibitor, or ranitidine, bismuth citrate, sometimes triple therapies, right? May include like lansoprazole, lansoprazole, omeprazole, and then ranitidine, right? So it could be a triple therapy. Usually, though, it's at least a couple meds, right? It might include an antibiotic for sure, like amoxicillin or Flagyl, right? That the patient will take twice daily. Again, we need to reduce anxiety, reduce the patient's anxiety. Nurses need to use a calm approach and explain all of the procedures and treatments. We need to promote optimal nutrition for the patient. For acute gastritis, the patient should take no food or fluids by mouth. We're going to introduce clear liquids initially when we start back with food and fluids, and then we will advance the diet as prescribed, right? And of course, we're going to evaluate and assess frequently, and then of course report any negative symptoms to our provider. We are going to discourage them drinking any caffeinated beverages, any alcohol. We're going to discourage any smoking cigarettes at all. And we're going to refer them to counseling for, smoking cessation, alcohol cessation, all of that. Let's see, what else do I want to say? We're going to promote fluid balance. We're going to monitor I's and O's. We're going to definitely watch them closely for signs and symptoms of dehydration, any type of electrolyte imbalance, any type of hemorrhaging. We are going to provide any, things to relieve pain, like medications and possibly diet, right? Peptic ulcer disease is characterized by discontinuation in the inner lining of the gastrointestinal tract because of gastric acid secretion or pepsin. It extends into the muscularis propria layer of the gastric epithelium, right? So we have this deterioration of that tissue. It usually occurs in the stomach and the proximal duodenum. The most common causes of ulcers is infection of the stomach by a bacteria called Helicobacter pylori, or H. pylori. Most people with peptic ulcers have these bacteria living in their digestive tract, right? And risks include excessive secretion of stomach acid. There are some dietary factors, chronic use of NSAIDs, chronic use of alcohol, smoking, familial tendencies, having untreated stress, unmanaged stress. Sometimes it can be simply eating spicy foods all the time. Many people with peptic ulcers don't even have any symptoms, right? They may not even be aware. Less often, ulcers may cause severe signs or symptoms such as vomiting or vomiting blood, which can appear either red or black. Dark blood in stools or stools that appear black or tarry, so tarry looking. When manifestations do happen, they are less severe. When manifestations do happen that are less severe, they include a dull gnawing pain, or even like a burning in the medial area of the gastrin, heartburnish type feeling, stomach burning pain. And this sometimes can be connected to intolerance to eating like fatty foods, right? Or maybe causing nausea and or vomiting when you eat certain types of foods, fatty foods for a lot of people, right? Treatment for peptic ulcer depends on the cause. Usually treatment includes killing the H. pylori bacterium if present, and or eliminating or reducing the use of NSAIDs if possible, and helping the ulcer to heal with medications, right? Medications again would probably include antibiotics to kill the H. pylori. So that may be amoxicillin, it could be Flagyl or metronidazole. That's the generic for Flagyl. Sometimes levofloxacin or tetracycline, those kinds of things, right? Those antibiotics. Also, medications that block acid production obviously would be utilized that will promote healing. So like a proton pump inhibitor or PPI, which will help reduce the stomach acid by blocking the action of the parts of cells that produce acid, right? Some of these drugs might include over-the-counter or prescription like omeprazole, Prilosec, Prevacid, Nexium, Protonix, Pantoprazole, all of that, right? So again, medications to reduce acid production like H2 blockers, histamine H2 blockers would reduce the amount of stomach acid released by the digestive tract, which of course relieves ulcer pain and encourages healing, right? So again, over-the-counter or prescription acid blockers would include things like famotidine or Pepcid, cimetidine or Tagamet, right? And then we also have antacids that neutralize stomach acids, right? So antacids can provide symptom relief, but generally aren't used to heal a patient's ulcer. Medications that protect the lining of the stomach and small intestine would also be recommended, right? So doctors may prescribe medications that are cytoprotective agents that help protect the tissues that line the stomach and small intestines. Those could be medications like Carafate or Sucralfate or Cytotec or Misoprostol, right? So basically all of these different meds are used to treat peptic ulcers, right? Left untreated, peptic ulcers can result in internal bleeding that can occur as slow blood loss at first that would lead to anemia, or it could be a severe blood loss that may require hospitalization or even a blood transfusion, right? If it's that bad, it can be bad enough. Severe blood loss may cause black or bloody vomit or black or bloody stools, right? So remember, in your stomach, if you're vomiting blood, it usually appears like coffee ground emesis. And then if you have bleeding in your stool, it usually appears as tar, looking dark tarry substance, right? If it isn't treated, if these peptic ulcers are left untreated, they can also lead to a hole or perforation in the stomach wall. So literally, peptic ulcers can eat a hole through or perforate the wall of the stomach or small intestine, putting the patient at risk of serious infection of their abdominal cavity, which we call peritonitis, okay? So it's extremely important that we do treat it. The other thing it can lead to is, if not treated, is obstruction, right? So peptic ulcers can block passages of food through the digestive tract, causing the patient to become vomit, lose weight through inflammation, scarring, all of those things. And finally, peptic ulcer disease can lead to gastric cancer. Okay, so studies, evidence-based practice has shown that people infected with H. pylori have an increased risk of gastric cancer, so it should be treated, right? Now, look at this picture. This shows you exactly what a peptic ulcer looks like in the stomach and small intestine. Look at that. No wonder it hurts, right? Many times. You can see the damage there. So, how do doctors diagnose a peptic ulcer, right? And how do we do assessments with patients with peptic ulcer disease? Well, first and foremost, we get a medical and family history, right? We use these to help diagnose peptic ulcers and to check for factors that cause ulcers, right? So to do that, we're going to ask questions about presenting signs and symptoms, right? We're going to look at diet history, because there is a dietary association with symptoms with peptic ulcer disease, right? Going to do a physical exam, probably do a 72-hour diet, so that we can see if there's any correlation between the types of food patients eat and the symptoms, or maybe even medications to the signs and symptoms. We'll do an abdominal assessment, vital signs, we'll do blood test. We will do a urea breath test, a stool test. We will assess if the patient's taking any medications that could lead to gastritis or peptic ulcer disease, like NSAIDs, aspirins, etc. We will assess the patients for anemia and or bleeding. We might do an upper GI endoscopy and biopsy, maybe an upper GI series. Again, upper GI endoscopy is when a pathologist will examine the tissue under a microscope, right? Doctors may use upper GI endoscopy to diagnose gastritis or anything going wrong with the gastric system, right? helping determining the cause, and then of course managing the complications from it. Goals of patient care include alleviating any symptoms of nausea, vomiting, diarrhea, and pain, reducing the amount of acid in the stomach so that the stomach can heal and ease symptoms, preventing further spread of infection and transmission to other people, providing dietary recommendations and guidance for fluid intake, reducing anxiety of patients, maintaining nutritional requirements of patients while being treated, and monitoring and being absent free of complications, right? Such as severe dehydration or bacterial infection and things like that. Nursing interventions for patients with gastritis and peptic ulcer disease include relieving pain, reducing anxiety, maintaining optimal nutritional status, monitoring and managing potential complications, including hemorrhaging, perforation, penetration, gastric obstruction, all of those things, right? Also, patient education is very important. Engaging in excellent hand washing habits to prevent H. pylori infection spreading, managing stressful situations to reduce the chance of having stress-induced gastritis, avoiding eating spicy foods that could cause it to be more inflamed and painful, limiting caffeine consumption, limiting alcohol consumption, stopping smoking. They should maintain a food diary, monitor the quality of food ingested, monitor and document the amount and quality and color and frequency of any vomiting, documenting any nausea, providing a diet that is diverse based on, their diet plan, supplying food in portions that are little but often, right? And then, of course, collaborating with management of their medications, right? Again, stress management and anxiety management is key, right? So we need to assess anxiety, speak in a calm manner, explain all the procedures and treatments to the patient, help identify stressors for them, and explain various coping and relaxation methods such as biofeedback or hypnosis or behavior modifications, right? All of these things that we can do to help lessen the amount of stress that they're in. All right, this is the end of this chapter.